Good afternoon, evening, and welcome everyone to the Macon County Health Department Board of Health meeting for Tuesday, February 15th, 2022. Roll call, please.
Vivian Goodman.
Here.
Mark Scranton.
Here.
Jan Hack.
Here.
Sue Krause. Candy Clevenger.
Here.
Jeff Entler.
Here.
Debbie Hill.
Here.
Dr. Greg Jerger. Dr. Benjamin Ganchi. Cody Parks.
Here.
Dr. Janet Patterson.
Thank you. Are there any changes to the agenda? Okay. I'll entertain a motion to approve the agenda topics.
So approved, or so make a motion. Second.
Thank you. Roll call vote.
Vivian Goodman.
Approved.
Mark Scranton.
Approved.
Jan Hack.
Approved.
Candy Clevenger.
Approved.
Jeff Entler.
Approved.
Debbie Hill.
Approved.
Cody Parks.
Approved.
Motion carried. Public comment, there was one that Brandy passed out, so you guys can read that on your own. It's actually a resend from our last meeting. So. And there was no other public comment, correct? Okay. Approval of previous meeting minutes. The board meetings were in your packet. Hopefully everyone had a chance to read those.
I have a question on that, Madam President. When I looked at this earlier, it is my understanding there was a quorum of 6 people here for the meeting last month. Obviously, I wasn't here, but on the roll call, it only indicates 5 people. So I don't know if somebody was marked absent, came in later in the meeting. It appears that Dr. Patterson came in at some point, but I don't know if that's an error on the initial roll call or if she came in the meeting after the meeting had started.
I'm trying to remember not get mixed up with another set of minutes. I know that we did have a quorum, and I'm not sure if this is the meeting where somebody did come in a little bit late.
Well, I saw it in the minutes. I read through them just to try to figure out where the timeline, but I saw where Dr. Patterson had made a motion to approve on the acceptance of the financial report. So I don't know how far into the meeting that was. I'd like to clarify that for the record, because if we didn't have 6 people at the start of the meeting, then you couldn't do anything until you had 6 people.
No, I always make sure that we have 6 before we would vote on anything. So my assumption is most likely that it is an error of her being marked absent. I will double check that. And of course we have the recording, so we will be able to verify so that we can correct that as marked as her being present.
I would make a motion then to approve the minutes with that exception being checked.
Second.
Other discussion? Okay, roll call vote.
Vivian Goodman.
Yes.
Mark Scranton.
Yes.
Jan Hack.
Yes.
Candy Clevenger.
Yes.
Jeff Entler.
Yes.
Debbie Hill.
Yes.
Cody Parks.
Yes.
Thank you, motion carried. Communication.
All right, just a couple of things in communication. The first is, Dr. Meneganti, I will hand you yours, but I did pass out the statements of economic interest. We are required to have certain staff and then board members complete and turn these in. So if tonight before you leave, if you can fill that out and turn it in, then that's great. Otherwise, if you can get it back to me as soon as possible so that I can submit it back to the county, I would appreciate that. I did ask for clarification on if there are errors, how you can correct that. I have not gotten that guidance. So if yours has errors, you can just let me know. I don't know if I'll have to request a new form from the county or if you can make that correction on there. So just let me know if you have an error and we'll take it from there.
Have they changed these where you don't have to have it notarized when you sign it then now or not? It used to be you had to have it notarized when you signed it.
No, we haven't had to do that.
Okay,
And-
okay.
Yeah.
Yeah, I think
I didn't know something changed with that. It's been a while since I've done one, so.
Does anybody have any questions about those? Okay. And then the other communication piece is just an update with COVID and where we're at. You're probably seeing it in the reports that you're getting. Basically, we're kind of on the other side of the surge, not completely out of it, but working to be, of course, we don't know what the future will hold, so we're still encouraging everyone to take those precautions and get tested if they're not feeling well or if they've been exposed, et cetera. Our case rate right now in Macon County is 355.74 per 100,000, and the target is 50 with that. So definitely still a lot, but not nearly where we were last time we chatted together. So another update, you have probably seen in the news that they did pull back the request for approval on that Pfizer vaccination for the younger kiddos, and they're hoping to get something out in April. We were ready for it to come and start right away, so we'll be more than ready when it does come in, hopefully April for our community. And that's really all that I have as far as COVID update at this time.
Where are we at as far as contact tracing? We still have people here doing that?
We do, yes. So our contact tracers, just as a reminder, they are 24/7, so they are still, not 7, or not 24, but 7 days a week. They're working about 7:30 a.m. to 8:30 p.m. They have different shifts, they alternate, so they are working the 7 days a week to ensure we do have adequate coverage. And in addition to that contact tracing that they're doing, they are still assisting with handling all incoming phone calls and questions associated with contact tracing. As a reminder, with that centralization to the state, to the Surge Center, there have been some changes in how we as a local health department are supposed to prioritize what we work on. So a lot of shift has occurred to focus on outbreaks, clusters, supporting long-term care or congregate facilities to ensure that spread is limited in those areas. So even though the state has taken on some cases, our team has still been pretty busy. We have had some people that may be moving into different positions. So as we lose those positions, we will not, or if they resign and leave, we will not be replacing those positions at this time. The original funding that we had, that contact tracing money, as a reminder, that ends March 31st. But then the crisis grant money does continue after that. And then we did have that additional grant we discussed last month that has funds to continue beyond COVID. It will cover COVID expenses, but then also other communicable disease efforts far beyond COVID, what we would normally be responding to. So that's going to help us be able to sustain response for communicable disease. But yes, to answer the question, we do still have a team here. They're also helping with vaccination clinics. So they're still very busy, but as numbers have dropped and hopefully will continue to drop, we have been talking with the contact tracers and being very transparent about if and when their employment is no longer there or if the funding ends. So they have definitely been communicated with about all of that.
How many people do we still have currently?
So right now we have 31, but that includes supervisory staff, which some are like the health department staff that work on other things that were not hired just for contact tracing. It includes our school team, long-term care team, care resource team, our emergency preparedness coordinator. So that's not all just temporary contact tracers that we have.
Okay, well, as I talked to you the other day about, I was curious about where was that with this, because I have concern because I'm 7 weeks now, and I've never had anybody from Macon County Health Department contact me, nobody from IDPH. I know several other people that I know that ended up being positive. They've never been contacted by anybody either. So I would like to find out where the gaps are, because that really bothers me that we have people that are supposed to be doing this job, and I was out 30 days, as I told you, 30 days, I haven't had one single person contact me at all from either department. And if we have a process in place where we're supposed to be following up and doing this, something's fallen through the cracks, because it wasn't just me. I've talked to several other people just in the last 2 weeks that have gone through the same thing. 2 of them ended up in the hospital. They've never talked to anybody.
Well, I'm glad that you brought this up. I won't speak specifically to your situation. If you want to speak about that in private, I'm more than happy to look into it or give you information about your case specifically. But I will say, just as a reminder, at the beginning of January and then at the end of December, we did talk about the centralization to the Surge Center, which would include not everyone getting a phone call. Everyone gets a text message, and then they have the ability to opt in or out. If someone doesn't have texting capability, that will be shifted to the local health department, who will call and follow up. But if someone gets a text and they don't opt in, they may never get a phone call. And that's one of the reasons we did the press conference with our partners, because the huge number of cases that were coming through during that surge, the state said they couldn't even handle all the cases. So we did do a lot of communications about, you may never get a phone call from your local health department or IDPH. These texts are going out, but we need everyone to assume a level of personal responsibility for your contact tracing, letting people know that you ended up being positive and they've been exposed, letting them know or encouraging them to get tested. So that, for anyone that hasn't gotten a call since then, that's pretty much right in line with how things are supposed to be moving along.
Well, that's why I want to make you aware of that, because I knew that transition period was taking place, but I figured one organization or another is going to be following up and doing something.
Not with everyone. People can totally opt out of contact tracing, and
I
they
never
can
got a
never
text
get a call.
message or anything.
Well, I'm not, like I said, I won't speak to your case
No.
specifically. I will in private
I want
with
to make you
you.
aware of it,
Yeah.
because it being a transition, you have expectations that the state is going to take on this task that has been getting done locally and been getting done pretty well, I think. And now all of a sudden, there's these gaps there. And it didn't matter to me,
Right.
but I know the other people that I've talked to, they were very concerned about it, because everybody's situation is different.
Right.
But I just wanted to bring that to your attention and the rest of the board, and say that that's something that needs to be followed up on and monitored, going forward.
And we have done that, because if you recall, we had talked about, we realized that when the state was supposed to be taking calls effective on December 28th, there were voicemails that were getting shifted to local health departments that then would kind of disappear in an abyss. And so we worked with the state very proactively on ensuring that we could access that information and finding out where it was going so that our community was being served, and then make sure to put out that communication to our Macon County residents and said, if you don't get called or if you can't get through on this 312 number, please call us directly and we can help you. So yes, I'm sure there are a lot of people who haven't been called, and I think that was always the intention of IDPH in the transition. And that's one of the reasons I do think it's incredibly important for us to continue to staff the people that we have right now while this funding is here, because we do have to have a local point of contact that answers the phone and gets back to people. And if they can't find the information online, or if they can't read, or they don't have internet, that they do have a way to speak with the Macon County Health Department and find out what to do.
Do you feel that maybe we need to put that out there, like you are putting out other PSAs about vaccination, things like that? Don't want to drag the health department back into something the state's supposed to be doing, but people are not sure who to even contact. So if you're saying if you don't hear from somebody, you should voluntarily take it upon yourself to call. People, number one, wouldn't know they need to do that. Number two, they're probably not sure who they need to be communicating that information to. I think that might be an important thing to look at and figure out the best way to put that out there for the public, because I can tell you, there's people that definitely don't know that they're supposed to do that.
Well, they don't have to. It's just that they have questions and
But it's a good
can't
idea.
navigate it themselves.
Right.
And I will say, we have put out a lot of communication about that. We can certainly do more. But we did put that out pretty extensively. So I understand not everybody accesses every news resource or our resources. We can certainly put it out again. But I think we did do that pretty thoroughly when all that adjustment was made, but I have no problem doing it again by any means.
Randy,
Yes.
including the numbers, they don't include the numbers of people who are positive from home tests,
Correct. Yeah.
because we don't know what those numbers are.
I have a follow-up question. On 12/28, when the state took things over, what percentage of the contact tracing work did they take over from you?
Well, they didn't end up taking all of it on the 28th. That was their original intent, and then they did push it back. As of the 28th, though, they started this text messaging. So on the 28th, people started receiving a text message if they had text messaging capability in their phone, and having that option to be connected to the 312 number. And that's where we found that there was an issue with the state getting voicemails to us in an effective manner, because when they would call the 312 number, it would ring and say, nobody can answer your call, you're being redirected to the local health department. It would ring not here and just be, you leave a voicemail. And then there was that disconnect of where these voicemails going. So then we had to work with the state search center, the Salesforce program, to be able to access those phone calls. I don't know the exact percentage. I would have to look
I mean,
at
did
that.
they intend to take everything over?
No, that was
I
never
didn't
the
think so.
intent.
And what things did they intend to lead with the local agencies?
So even the search center has told us they are prioritizing which cases to work. So if somebody opts in, obviously that's somebody that's going to be, taking care of their phone calls answered. 65 plus population is a priority group that they are prioritizing as the search center. And then for local health departments, their intent with us was that we were going to focus more on people who did not have text messaging capability, because if their text failed, then they would get directed to us automatically. So that group, and then also long-term care or any congregate facilities. So you're talking every long-term care, assisted living, any facility of that nature, group homes, jails, prisons, any of that, homeless shelters, day centers, those types of places would be more of our priority. And then anywhere that would be dealing with an outbreak or a cluster, which was many of our schools. With this change, one of the things that the state wanted to shift to was putting more of the responsibility back on schools, because per the executive order, and I'm going a little bit backwards here, but per the executive order, they were supposed to be completing the contact tracing or exclusion of children from school who had been exposed or who were positive. So that was to be taken more off of our plate, which that was a huge part of the workload at that time. That was to basically the responsibility to be shifted back on schools. We were still going to be there to support them and then also help them manage any outbreaks that they would possibly have. But most of that responsibility was to be put on them. Now, of course, some things have changed with some of our school districts with the temporary restraining order, but there still has been no shift as far as responsibility back on us. We were still doing daycares as well, but they did just change the guidance for daycares last week or the week before. So that is more shifted now to look like what your K through 12 schools look like and how that's being managed.
So if you took a guess at it, half the work went to the state, quarter of the efforts and things that you did went to the state, or?
I feel uncomfortable making a guess. I had numbers and I could bring that back, but the percent, I did have numbers last month as far as like how many the search center and how many we had taken, but it's going to fluctuate because if someone calls the search center or if the search center pushes someone to us, we're going to take them. So it's not always going to be like the search center's handling 50% and we're handling 50%. And if some people opt out, then not even all cases are going to be worked or contact traced, if that makes sense. So it is going to fluctuate quite a bit. I would say when this shift first started occurring, our workload of not only cases, but dealing with all the phone calls that were coming in for people who either weren't being helped completely by the 312 number, who had outstanding questions, a lot of that came to us. So I could give you a percentage all day about like the state took 3/4 of the actual cases and we had 1/4 of the cases, but that still doesn't reflect all of the calls then that come in that they still have to work. Does that make sense? Like they're assigned to the state, but then sometimes we still end up working them. If there's someone that calls and says, I don't know what I'm supposed to do, I'm positive, can you help me? Then we help them. We don't say, you're supposed to be handled by the search center, we're not helping you. We still help them so that they do have that local point of contact.
I'm just trying to get a little bit of a metric to maybe compare it to the contact tracing needs. I mean, do you need 100% of them, of the 31 people? It sounds like you do.
Well, I would say not all 31 are working that regularly. So when I say 31, I'm including like leadership staff or other staff who are assigned to, let's say, communicable disease or administration, who are fully trained, but that's not our duty and we weren't hired under that grant. If that makes sense. And we do still have some full-time and some part-time. So as we had talked about earlier, as the need goes down, then obviously the use of part-time will go down, and then we'll look at full-time and how can we either use them for other tasks such as phone calls, vaccination clinics, Or do we get to the point that we, in their employment because we don't need them anymore where the numbers are? And that's something obviously we're looking at every day because we go from, 100 something cases a day to well under 100. So that may be, and they've been told that may be a quick decision that has to be made and you may not have a lot of notice, but we can't, when numbers get low, we can't keep everybody
Is the
on if they
state,
don't
is the
have.
state gonna dictate that?
No.
Or is it still a local decision?
It's still a local decision.
Okay.
Of course, as long as we have funding and, the board approves funding if it's outside. Like right now, the state has the recommended number of people that they want trained. But now the surge center is helping handle things. So we report on that every week, how many contact tracers we have. But they have not been involved in dictating how many we have to have or telling us you need to get, release staff or anything of that nature.
You said the funding was going to end March 31st.
That's just the original contact tracing grant funding. So we do have the COVID crisis grant that we already, have, and then the one that we're applying for that's due Friday, which is non-competitive funding that we pretty much are guaranteed as long as we apply. Now that being said, we've not told these staff you're guaranteed a job because we're getting this grant, and we've told them needs are going to change, as we go through this pandemic, as the state transitions to the change in expectation, then our change in staffing needs is going to be there, and it might change very quickly. Another thing I just want to, go back and reflect on is when the state did make this change to centralization, they did make the point that at this point in the pandemic, contact tracing is not as effective as it was earlier on. People are listing fewer and fewer contacts. Then you try to call the contacts, they don't answer. So what the state has talked about is shifting focus, shifting resources, shifting attention to where you can really make the most difference. And that's when they talk about long-term care, they talk about congregate settings, vulnerable populations. So they know and are being, I think, purposeful about, we're not going to talk to every single person that's positive and go through that contact tracing process with everyone that's positive. Because that is not the most effective way to handle this anymore. So that's why they have the prioritization that they're using and then have given us what we're supposed to prioritize and focus on. But if someone calls and they're not in a priority group, we don't just say, oh, we can't help you. We still talk them through everything. If we can complete the interview, we do that. The state, as we talked about in December, the state changed that centralization very quickly and without very much notice. So that could happen again. And I told the staff that as well. The state could tell us, hey, 2 days from now, we don't want you doing anything but contact tracing only in congregate settings. We always do contact tracing for communicable diseases. It's not just COVID. COVID was just so much greater as far as how much of it we were doing. So their expectation could change. It could change quickly. We made sure to tell the staff that, and that there could be a change in our staffing needs very quickly as well.
We've seen some statistics from your call volumes, haven't we? At one point in time, as to the calls that the contact tracers are getting.
We might have brought numbers of calls that we have coming in. That's a harder one. Like what I may have showed you was call statistics from Salesforce, which is the contact tracing program, but none of the phone calls that come into the health department that we handle that are care resource, daycare, schools, restaurants, businesses needing help and support with these things, or just, your random citizen that calls and just needs help or talked through something. None of that will be reflected in those particular metrics. So to be able to pull all the metrics from every single call line that we have that comes in would be very, very difficult. We've streamlined things as much as we can in the building for phone calls coming in. But people still kind of call over the building. So certain communications we have given to every single staff person in the building so that the public can get more efficient answers to questions if they're very simple questions. Obviously, anything more complex we forward down to contact tracing or nursing staff or emergency preparedness or administration. But it would be very difficult outside of just running a report from Salesforce to really show how many calls per day are contact tracing or COVID specific.
Thanks.
Thank you, Randy. Moving on to presentation and acceptance of financial report. Julie?
The report is in your packet. It is as of the end of January, which is 17% into the fiscal year. Fund balance is at $5.7 million. Total revenue 1.7 million, which is 26% in the budgeted revenue, and total expenditures at 1.1 million, which is 17% of budgeted expenditures.
No questions, I'll entertain a motion to accept the financial report.
Make a motion to accept the current financial.
Second.
Thank you, the roll call vote?
Vivian Goodman,
Yes.
Mark Scarrington,
Yes.
Jan Hack,
Yes.
Candy Clevenger, Jeff Emler.
Yes.
Debbie Hill. Yes. Dr. Vincent Mendoza.
Yes.
Cody Parks.
Okay. Department expenditures are also in your packet. Did everyone have a chance to review those? Were there any questions regarding the department expenditures? Not? We will be a motion to approve.
So moved.
Thank you.
Second.
Thank you. The roll call vote?
Vivian Goodman,
Yes.
Mark Scarrington,
Yes.
Jan Hack.
Yes.
Candy Clevenger.
Yes.
Jeff Emler.
Yes.
Debbie Hill.
Yes.
Dr. Vincent Mendoza.
Yes.
Cody Parks.
Yes.
Motion carried. Any grant applications?
There are not.
Department division reports are also in your packet. Did anyone have any questions?
I did add your annual report as a separate, and I just printed it black and white, so we didn't cost more money with that, but this will be going out this month, so it'll be posted nicely online. It's always sent out to the media, it's on our website, it'll be sent to the state, and it'll be the nice color version, but just wanted you all to have that as well.
Okay, we want to thank the staff for all the great work that they continue to do. Thank you for the reports. Employee recognition, the February anniversaries were celebrated and acknowledged at the January 2022 meeting, so we don't have any to acknowledge tonight. Old business. Discussion and action for appointment to committees.
Do we have anything left on that? I thought we only had one committee appointment left.
I think just Cody.
Yeah,
think 'cause
because he
Cody-
wasn't here and we nominated him without him being here.
Yeah, that was the only one that was left for voting.
You got nominated for a committee, you weren't here. That's what happens when you don't come to meetings. Unless you had an objection, that was where we left it at.
Don't be weird.
So you accept the nomination, Cody?
Yes.
Okay.
Can we clarify what committee it was? Because I honestly don't remember, it was 2 months ago. No, maybe it was 3 then.
It might have been 3.
Yeah,
I can check.
it was December meeting.
That's what I have in front of me too.
Sure. Yeah, December meeting.
Perfect. Nomination? Yeah, I think I remember reading that.
And there was one opening on that too, yeah.
Okay, so do we need to vote on?
Yes, please.
So I don't know who made the nomination, but we'll entertain a motion to move Cody to the nomination committee.
So moved.
Second.
Thank you. The roll call vote?
Sorry, what's this one? Nomination committee
Yeah.
The nomination committee,
for the members.
that is Jan Hack, Dr. Menegatti, and hopefully Cody.
Need 3 of them, right?
Yes.
Roll call.
Vivian Goodman,
Yes.
Mark Skrillex,
Yes.
Jan Hack.
Yeah.
Kenny Clevenger.
Yes.
Jeff Engel.
Yes.
Debbie Hill.
Yes.
Dr. Benjamin Johnson.
Yes.
Tony Parks.
Yes.
Oh, I'm sorry.
Motion carries. Thank you. Macon County Board Resolution.
Yes, so this is one that probably looks familiar to you. It is the cottage food, and in my board report, I did put an update about that. When it went to EEHW, they were very concerned about the $350 fee on there. So they wanted me to bring it back to you to reconsider a lower fee. So I don't know what, I mean, that's totally board decision, but basically Kathy just updated it to re-reflect the 150 where we started, and again, the EEHW just wanted me to bring it back to you for you all to discuss and consider lowering that. I did tell them that you all had previously discussed possibly increasing some of the other fees, but that wasn't done yet. So that may be coming down the way as well. So I told them that I would update them after tonight and then send them our list of all the other environmental health fees, just so that they have it and kind of have a heads up well in advance. So if you all decide, I know last month it was decided not to do anything with those right now, but if you all end up deciding that you want to, then at least EEHW has it far in advance. And so that will go back, depending on what you all do tonight, I'll send that to them just so they have it following this meeting, but then depending on what you want to do with the resolution, then that would determine.
Brandy, after, obviously, you went to the meeting here, EHW, so what is your take from that meeting, the conversation? I mean, I'm just reading through the minutes here about it, but I mean, how strongly do you feel that they oppose that cost? And I mean, I guess, are we out of line by sticking to the decision we had of making that recommendation? I mean, I'm okay with maybe revisiting that, but as we talked about before, as I recall, part of the issue we had was, you know, there's obviously some advantages to a home operation versus a commercial business that spends a lot of money for overhead costs and everything else. And I think, in my opinion, I think in certain situations, I think that because they aren't being, having as much oversight and not subject to some of the things that the regular restaurants and bars and stuff are, I think the potential risk factor for the public well-being is a little bit higher risk. But again, that's on the environmental staff to, you know, do their due diligence to qualify people to start with, and then making sure they've got, you know, good oversight. But I think we talked about it before. I think there was a reason why we were looking at the higher price. Quite honestly, I don't remember everything we discussed.
I think Kathy Wade was talking that,
Was time it took.
yeah, and.
Right, that's what it was,
you
the
know,
time spent. Because we're talking about
and,
$50, and you can't send a staff person out there for an hour. We're spending more money than what
And
we're
she don't
collecting
have
out
the
of it.
time to do that extra
Yeah,
stuff.
that's one of the things we talked about. Yeah, I remember that now.
Yeah, then they also
And with
said that's how
COVID.
we got to the, redoing all of them, because it took the same amount of time to do that. That one as it did the other ones, that's why we looked at all of these.
Running for my information, was there a fee before? What was it? Or it went up to 350?
There was not a fee before.
It's brand new.
Yeah, that's what.
I mean, cottage food has been happening, but the fees now
Right.
associated with that's the new part, and so
It's just an honor before, whether it's a call.
they registered, and yeah, but there was no, you know, fee associated with it or anything. I think so, to answer your question, Mark, I think one of the bigger concerns for EEHW, and tell me if I'm wrong, but they were concerned about if somebody kind of has it out against someone, like we've talked about in two. Yeah, I said, you know, our board brought, it was almost the same concerns that some people in this room had voiced as well. It almost, you know, mirrored it exactly. And so, and I told them that, But they were concerned if somebody has a vengeance and they want to try to get somebody in trouble or cost somebody money, that they would just make a complaint to do that. And I know Kathy had made the point, a couple of points, one being, we haven't gotten a complaint before with this. So hopefully we wouldn't, but of course, again, if someone has a vengeance and they know there's money attached to it, that could change. And then another thing she said was, when you go in and do an inspection of a home kitchen, they automatically would have violations of like an FDA food code. So there would automatically be that inspection. I thought a really valid point, an interesting point that was brought up by one of the EEHW committee members was that this isn't a fine, it's a fee. So this is like the cost for us having to go out and do it. It's not like we're not penalizing them for, what's there, but it's the fee for having to go do it. And that was the perspective of an EHW member. And I'm like, I appreciate you bringing that up because that does kind of give a little different perspective. So I don't feel like it was a good conversation. And I think, different people had different thoughts in there, but I think they really just thought to go from, the 0 all the way to 350 was a big jump.
Is it for a whole year?
Well, that's just an inspection. So the registration fee, the $50, that's for their registration. So that's flat. The inspection would be anytime they're sent out for inspection. So that could, compound, depending on how many times someone was sent out. The 150 is what Kathy originally brought. And then the 350 is after discussion what the board proposed when we did take it to EUHW.
If we do original, like the first visit is this much, and then every visit after that could be a certain amount.
I mean, it's up to the board.
Well, in the minutes here,
Confusing.
and Mr. Baggett got kind of put in the spot because he wasn't at the meeting. And so a comment from Chairman Little was that she had concerns about it, but without Mr. Baggett being there. So, Mike, you have an opinion about how we could structure this? Could we have a flexible sliding scale based on what the staff feels is appropriate when they go and visit, or we just have to have a predetermined flat fee for this inspection to begin with?
Now, the board is within its, ultimately, the county board is within its authority to set the fee in whatever fashion it wants. It can be a flat fee applicable to.
The county board or the Board of Health?
The county board is the one who sets the fee.
Okay.
The Board of Health is making a recommendation.
Okay.
I mean, frankly, you mentioned earlier, sticking to your guns, you can certainly make the case to the county board that you want to stick with the 350, but if the committee doesn't want to go forward with that, they can amend that down, and ultimately the county board will make the final decision on what the fee will be. But obviously, in terms of setting any type of policy or creating any type of particular plan, the Board of Health is in a better position to make those recommendations and to argue for them. What the county board does with the recommendations is its call. But to answer your original question, can you set anything other than a flat fee? Yes. If you want to develop a sliding scale based on, I don't know, size of operation or other factors, I can't begin to pretend I have the expertise to guess how that would work, but that's what you have a staff for. And so if that's what they come up with and it's something the Board of Health wants to recommend to the county board is convinced that's the right way to go, then that's certainly within everyone's authority to do.
Is it just one thing these people get to do, or many things?
As far as what types of food they can prepare,
Yes.
many things.
Many things. So they could make up thousands of dollars a
Yeah.
year.
Yeah.
Okay.
Well, the chairman comments that
I
he
could-
thinks $100
if I
would
could
be
add-
enough. Kathy had recommended 150. If I remember right, that's what it appears to be, that's the recommendation we had in here from her originally. Is that correct, Randy?
And there was a recommendation of 500 from, I can't remember who, someone on the board, and then,
We discussed several different
Jerger.
costs. If ultimately, as Mike's saying, if it's ultimately up to the county board and the environmental committee to approve it, I'd say it's brand new. Maybe we revisit this a year down the road and see what happens. I'm okay with going back and amending our fee on this and reduce it down to $200 or $250. At least we're giving some movement to the board and showing that we understand. Obviously, it appears to me, Brandy, this looked like this was a pretty lengthy conversation.
It was.
And the amount of minutes that are in
Are
here.
they
and
getting
obviously Jeff was
inspected
there.
like restaurants though?
But I
at
mean,
the
this is
house?
per visit, right? I mean, every time they get a call, go out there, they're gonna be assessed this charge.
Yes.
I would hope that these people would do their due diligence and make sure that they're providing a clean environment and following, proper food safety guidelines. They should be subject to the same criteria as any other business.
Kathy said they're already in violation right off the bat, though, if she goes out, so how they gonna handle that?
Well, it's a complaint. I don't know, because I don't know. They don't feed a restaurant unless they're going on a complaint-based inspection. If they're just going to do a regular inspection, they're not incurring, the business is not incurring a fee, right?
No.
If there's a complaint and they go out and they find a violation, then they would be assessed a fee.
$75.
Yeah, like I think that's a priority. I could be saying the wrong
And
category,
it
but
could be up to.
yes, that was an example. It's like they would be charged $75 if there's a founded violation at the time of that complaint visit.
Would that language be the same for this then?
That, I asked that question as well, and, the way that Kathy answered that is that when they go into a home kitchen, it already has violations of the FDA food code. Like no home kitchen under this cottage food meets the requirements for FDA, so they would automatically be, if we use the founding violation criteria, they would automatically be getting a fee.
But I'm saying that if I call up and say XYZ company is making these cookies and you guys should go out and check them out. If they go out on a complaint, whether it's anonymous or whatever, and they go out and do this and it's unfounded complaint, is it fair to that person to get penalized for something that's not a legitimate complaint? If they go out there, the person has made specific accusations, they go out there and look at that only, and that's all they're looking at, and they make the decision, yeah, you got a problem here, and we're gonna issue this fine, whatever it may be, or if they go out there and they look at it and say, you know what, we don't see anything here, then you just walk away from it, and you don't charge anything, because I mean, that's what you do at the restaurant, right?
Well, if we go in a restaurant and complain about one thing, but if we see other violations, we're not gonna turn
I
our eye.
understand that, but my question, I guess, is to clarify, if there's a complaint about a restaurant and Kathy sends her team out there to look at that complaint and they don't see anything, is the business owner currently charged a fee?
No, if there's no violation found. then
Okay,
no.
I think that's the way these people should be treated as well,
Well, and I
if
think.
you have that ability to do that.
That's what Kathy was saying, was automatically.
Well, I know, but Kathy's talking about looking at other things outside the scope of what the purpose of the visit is. I mean, if you went in there and saw
I know what you're saying.
bugs running around the kitchen or whatever, if there's something really blatant, I think we have to trust the staff to use some discretion on this stuff, because that's where I've got concerns about, because there's some people out there that are doing some great products out of their homes. And then there's some people that are doing really questionable stuff. I saw a picture one day on Facebook where this gal's making pies and there's a cat walking on the counter, and I'm like, so I mean, I guess I don't know where you draw the line at. I'm okay with reducing the fee if that will satisfy the obvious objections of the county board. At least this committee right now has some pretty strong objections, because we can always revisit it down the road on an annual basis, say, you know what, we had no issues this year, we're gonna leave it where it's at, or we had more issues, so we think that raising the fine will help, alleviate some of that. I'm good with going either way, but if everybody else feels as strongly as the committee does, and I don't know, Jeff, you were there, I mean, it sounds like there's quite a bit of objection to the 350 price.
I think there was a lot of it, there was consensus once the discussion was.
So you think we went to $200, you think it'd be better?
150 definitely, but 200's, I guess that's a good try. I think that the committee was just business sensitive. They want the cottage food people to succeed, and they think the $350 would be a barrier, that would potentially wipe them out.
Yeah, did you explain to them the costs that we're incurring by going out and doing a home visit? I mean, that's what we're trying to cover is
I
that.
think we talked a little bit about parity, or at least I did. And I don't think we had any discussion about the actual man-hour costs per se.
I don't think that we talked about that specifically.
Well, because I think that's what drove our discussion about charging more money, just because we're trying to at least recover what we're spending.
What about complaints being attached to the name? I mean, where somebody I can't just call 5 times in a row and make complaints, I don't like that person. Could they be attached to it and say, if you make a complaint, it has to be attached to a name? Is that a bad idea?
You know, Mike, I know that Kathy's talked to you about this before, so I apologize, I can't answer it as easily, but as far as with our complaints, and I mean, I know that we can take anonymous complaints, but what is your thought on what Cody just asked about requiring information to be left? I don't remember that off the top of my head.
If it's a legit complaint, they should have a name behind it, as far as I'm concerned.
No, I mean, you can require people to, provide their contact information or names, and as you know, if it ever needs to go into like a court proceeding, I have to have a complaining witness to call as I can't rely on hearsay. But for the types of inspections that you're talking about, that's not the same situation. Generally, you don't require that the complainant disclose their identity because you don't want to chill valid complaints from coming in. You don't want people worrying about whether if they complain on their neighbor or their boss or their friend for a violation of the health code, that the person they're complaining on finds out and then holds it against them. So there's a chilling effect when you require that complainants identify themselves before you'll take their complaint and act on it. However, you're within your rights to do so with the understanding that the end result may be that you have fewer people who are willing to make complaints, and that as a result, you may discover fewer violations of the health code. So it's a trade-off, but you do have the ability to do that, dependent on what the policy of the board wants to be.
Thank you.
Mike, one quick question for you. In your experience of having a higher amount of payment for these violations, would that improve compliance on the part of these business owners? In the restaurants that you have, you have been working on this for a while. And the second question is, you have a complaint and you go there and you found everything's fine, you're still doing the same work. And you go there and you find there's a violation and you get paid, whatever the fee is. So that means you're spending the same amount of work when you don't get reimbursed or paid for that, right?
To answer the first question, I don't know whether a high fee or a low fee really has what impact. I don't know that I'm qualified to answer what impact it would have on someone's likelihood of following the rules. Anecdotally, you can make an argument that if people are required to pay more upfront, they're going to be more inclined to be rule followers as opposed to rule breakers. But I mean, that's just a guess on my part. In terms of, a founded complaint versus an unfounded complaint, and whether that recoups the cost of what it takes to go out and do the inspection, at the end of the day, the fee isn't necessarily designed and shouldn't be designed solely to cover the expenses of the.
No, I didn't mean that way. I just want to know you will be spending the same time hours, investigating.
You revisit it after you've done a complaint, you have to revisit to make sure that complaint or that violation was corrected, right?
Yeah, and then the paperwork afterwards would probably take more time than if you just said unfounded versus having to do, full report. But I mean, that's more of an administrative piece.
Almost twice as much if you find something wrong.
I still think this is going to be a really difficult challenge for the environmental staff, because just picturing in my mind as you guys are talking. So we walk into the ABC restaurant in town, they're open normal business hours, inspector walks in, whether it's just a normal inspection or coming in on a complaint, they have parameters that they're going in there during hours of that store operation. You go to Kathy's Cookies because you're following up on a complaint or you're doing maybe a quarterly or yearly inspection or whatever. If you're showing up at a restaurant unannounced, then you're showing up to somebody else's house unannounced, you know, they're kicked back on their recliner watching TV, you know, they got a stack of dishes in the kitchen. They're not even making anything right now. So then I don't know, I would think that they've got to struggle with how to walk in there and say, okay, you don't have an acceptable, you know, environment here for doing what you're doing. Well, you said, I haven't done anything for 2 weeks. I'm not doing anything until next week. There's a sale coming up that I'm gonna make some stuff for. I think it's gonna be really hard for them to go out. I mean, obviously they gotta use common sense and discretion, but I think it's gonna be a real challenge for them to go out and inspect houses because that's what we're talking about for the most part. You're going into somebody's home and you're looking at what they're doing. They're not a normal operation like a bar or restaurant. I think that's gonna be a real challenge for them, aside from this fee thing, but that's just something else I've thought about since we talked about this.
If you get a complaint, I mean, what's the part we're gonna do? Call them up and say, you've had a complaint about something going on, I'm coming to your house, they won't fix that before you get there. You can't just pop in.
Usually they just go. Like I said, we haven't had one of these specifically before, so that.
You won't know until it starts.
Well, right, and I think that's something like we talked about before, that's gonna be, we look at it and, you know, if the board, you know, asks for a report, we come back and say, we've gotten, you know, 20 complaints, whereas we never got any in the previous year, and here's how it's going, and, you know, talk more about it if there need to be any adjustments that have to be made, but, yeah, I think you're right, something that we have to do, so we're going to be doing it regardless. I think the point, you know, with the fee and the allowance for that fee to be charged is that if we're having to do it anyway, that this is a way to not only have that accountability, but also help cover costs, you know, the expenses that would go along with going out and doing those.
Okay, so my understanding is then the committee tabled this thing, right? Is that correct, Jeff?
Are
So-
they waiting for us to
But
make a decision?
they tabled to bring it back to us, basically their concern is the price.
Yep.
So if they don't, if you
The
don't.
price and whether you could cycle multiple times, like we talked about earlier.
Well, Madam President, I'd make, I don't know if this is the appropriate time to do this, or I'd make a motion that we amend our previous vote on this resolution to $200. And I don't know if we want to include that would be subject to staff's discretion if they go out and do a visit and find it unfounded. I don't think it's fair to penalize them if they go out and find something that warrants that fee being charged. We're calling it a fee or a fine, I guess. The language will be important, and I don't know, Mike has an opinion on that, how that should be worded, but it's pretty obvious that the committee feels very strongly about this price. I'd be okay with doing $200 the first year and revisit a year down the road, because we spend the time on it now, I think.
They're doing it to
Okay,
make
and
money.
I started to speak early, but you cut me off, but
Oh, sorry.
Kathy had proposed originally the 150. Someone suggested 500, and I said the same thing that the county board said. Going from 0 to 500 was just, I mean, too much crazy. So why not just go with her fee? And try that, and, I mean, well, you saying 200, that's just $50 more, but we ended up with the 350 because of the 500 suggestion, and I asked to bring it down, and that's where it came down to, so.
Yeah, I'm just thinking about our staff's time invested in it.
I
because-
understand that, but the staff already, I mean, we have funds for the staff time already, right? So we're not setting fees to pay the staff.
I understand that, but the way Kathy explained it, they're struggling to get out and get to things now as it is because they're getting pulled in so many different directions. So this is like an extra thing above and beyond that they're gonna have to take on as another task now. That's the only reason I was bringing it up, that we charge more money. But I'm fine with whatever the board
That, I mean,
says.
200 is fine, it's better than 350, so.
Well, I think it gets us closer to where
But I was
the committee would like to see, and I'm sure that'll be something that the county board would be agreeable to.
I think it would be more, it would be more, like they would think about it before, if they had a fine of some substantial amount of money, they might keep their kitchen a little cleaner. You know what I'm saying? If you're gonna say $50, well, they'll say, $50 is not, I don't care if they come, my kitchen's a mess. I just think they need to have some kind of, something that will keep them on point of, keeping their kitchen clean. If they're gonna sell food, we have to do it, so I don't know why they wouldn't have to do it.
Okay, so we have a motion on the table for
A
200.
motion to amend the original vote to lower the price to $200.
You need a second?
I second.
I just noticed that the date for the meeting is incorrect on here. So if I can amend the date on the resolution as well. Is that fine?
Yeah.
That-
Okay.
If it's something like an incorrect date on, that's a Scrivener's error that can be corrected without a motion.
Perfect, okay. So the motion you said is to be $200 then?
Yeah.
For-
Okay. If no other discussion on that, a roll call vote, please?
Vivian Goodman,
Yes.
Mark Scranton,
Yes.
Jane Hack,
Yes.
Candy Clevenger, Jeff Bennett,
Yes.
Debbie Hill,
Yes.
Dr. Van Camden Garzi,
Yes.
Toby Parks.
Yes.
Thank you, motion carried. Okay, new business, discussion and action of media representative for Board of Health. Mark, was that you?
That was, we did bring
Sorry.
this, no, that's okay. We brought this last month. You had requested for this to be on the
Oh,
agenda. And
okay,
the
yes, I
the
remember
group
now.
decided to save it for when you were present, since
Okay.
you were the one that had requested it.
Well, I appreciate that. So I had brought this up to a discussion I had with Brandy over some issues with who should speak on behalf of the board to the media or anybody else that we would want to have speaking on behalf of the board versus, administrative or staff from the health department. And the reason I brought that up, and I was pretty adamant about it when I was contacted by a couple different people, was out of respect to the board president. The board president should be, at least in my past experience being on other boards, the board president typically is the spokesperson that speaks on behalf of the board. So out of courtesy and respect to you, I told him, I'm not talking to you guys about this. You need to talk to our board president. So with not having the ability to get communication back and forth without me talking to you or you calling me and saying, hey, if they contact you and you want to speak to this subject specifically, I'm okay with you doing that. I'm very adamant about having respect for my peers that I work with in organizations. And I think that would be extremely inappropriate for myself or any other person on the board to speak out of turn, so to speak, on a specific topic without either the approval or the blessing or something from the board president. I don't have a problem having a conversation with somebody about a particular subject, but I think that there needs to be a clear line of chain of command about how that's handled. If I've been on boards where the board president says, so-and-so is going to be our spokesperson for the board. It doesn't have to be the board president, but ultimately the board president should be the one to have that discretion to make that choice and that decision, I think. And I would respect whatever the president decided to do. And that's why when I was contacted about a couple different topics that came up in the past couple of months, I didn't think it was appropriate for me to comment about it. But of course, the media took that and twisted it another way to where it didn't come out the way I said what I said. But anyway, so that's why I wanted to bring it up, because I would like for all of us to be on the same page about when things do come up, that we either defer to, if it's something that we think that Brandy should be deferred to, or it should be deferred to the board president. But I would just like to have a clear line of thought about how this should be handled. And if somebody's not available, I mean, obviously if Vivian was out of town and wasn't available, I would assume the responsibility of the president's role as vice president, and then that kind of changes things a little bit. But I think for members, I think it's good, what path we choose to take when these things come up. And I did it purely out of respect for you in the office, because I think you should be the person, if you decide you want to comment on it or no comment, or say, I don't have a comment on it, but you can speak to so-and-so, then I think that would make me, it would at least make me feel better about how we move forward with the media.
So I think this, the particular situation, I was contacted by the media, but it was after, I didn't actually get to talk to them until after they had reported whatever they were reporting on the news. It was in reference to the vote, of course, to change the COVID reporting from daily to weekly. And I think they had already tried to speak with you, and maybe you.
They did. They called me and I said, you need to speak to our board president on this. It's not appropriate for me to make public comment.
But in a case such as this, I don't think the media is really gonna come to the board that much unless it's a case such as this where the board has voted on something that really affects the community. Otherwise, Health Department business, Brandy, and the media team that she has in place handles everything. But in this case, with you being the person who actually brought it to the board to vote on and presenting all of your information that you have and getting the vote, obviously I voted against it, so I didn't have anything to say. Even if I had talked to them before they reported, I would have told them, they knew I voted against it because they said it, it was on the news. But so of course I would have definitely had them speak with you.
But I didn't
As far as
have that information, and without your approval, I just wasn't gonna do it. I didn't think it's appropriate. I don't think it's appropriate that I speak out of turn on a particular subject, even though you voted one way and I voted, obviously, and others did too, voted the other way. If you said, hey, you want to talk to these people about this, I'm fine with that. Go ahead. I think we have to look at how we present ourselves, not only to the media, but also the community. So we need to have a structure in place to where when things come up, regardless of what they may be about, that we have a primary spokesperson that speaks on behalf of the board. And like I said, other boards I've been involved with, it traditionally has been the president, or it's been a specific person that the president has designated to speak, So I would just like to have it clarified for the benefit of everybody.
Has the board ever had a media person as far,
The only thing I can think of in recent history has been when there's a change in administrator, they would do, like a press release or something and assign someone outside of when it was me as public relations. But that could have been things that I'm not aware of, but that's what I'm aware of.
It always the administrator, right, that's speaking most of the time to the press.
It depends on what it is. We have, Marissa, our director of health promotion, public relations, and then her team. So if it's something that's maybe not as controversial as that particular topic was, or if it's something, if it is something more sensitive, like I've done a lot of the COVID press because it is more sensitive, or, been, press conferences and stuff like that, I feel like it was more appropriate for me to handle it. If it was a board matter, especially for this, I was not going to speak to, I could speak to what the board did, but I wasn't going to go beyond that. And they didn't ask me for an interview about it initially, but I probably would have forwarded that on to Vivian, because I do try to keep Vivian updated if there are major things. But I think usually our board hasn't really had a lot of media attention or media requests. So we might just kind of be in a very different chapter with COVID and all the attention and politics and everything that's been around it. There's just a lot more people that have things to say about what the health department's doing than usual.
does anyone else have thoughts? Do you feel that we need a media representative on the board?
I didn't hear what you said.
Oh, I just asked if anyone else had thoughts. What are your feelings about a media? Do you feel that we need a media representative on the board?
Not necessarily, but you can always designate depending on the context.
Yeah, that's a good.
As the president, you can designate someone who you think is knowledgeable in talking about that particular item or whatever happens then. I see Mark's point. I mean, he wanted someone to be able to a point person here. I see that point very well.
And Vivian, you're the president.
Yeah. Well,
You got that?
I'm sure you guys can see, well, you hear it in my voice when I talk. When I'm passionate about something, I may come over as a little aggressive, but, so I may not be the one to talk about an issue such as what happened, which is why I said I wouldn't have talked to them. I wouldn't have had any comments because it was totally something that I was against, and they already knew that, so.
I think maybe the best thing we need to do going forward maybe is because of that, it's either got to be a phone call or, in this particular situation, I mean, the problem is you're dealing with a window of time here that you have to try to provide some type of response. I could have very easily emailed you and said, hey, I need some guidance on how to move forward with this because I'm not sure. And if you felt it's something that should come from the board and not from you, then you got to get a hold of her somehow, and then she's got to provide you a response. And if she's not available by phone because she's working, same thing with email, it may be, a matter of hours or the next day or whatever before you can get a response back. So meanwhile, we're kind of in limbo. Like I said, I was very emphatically clear to everybody that contacted me that I did not feel it was appropriate for me to speak on this subject without the approval of the board president. I didn't have a problem talking to him. I just didn't want to do it. And then somebody comes back and say, well, gosh, you talked on behalf of the board and nobody gave you the authority to do that. I don't think that's an appropriate thing to do. Now, if she is board president, she can make that call. If she says, you can talk to whoever you want about whatever we've talked about, and I'm okay with that, that's all I need to hear. And it may not come up again, but I'm just asking for clarification moving forward. If we have this, come up again where somebody needs to speak on behalf of the board, I just want to know what the plan is and how we're going to, proceed to move forward to get that done. Because if we don't talk to the media about a situation, whatever the question might be, they're going to go ahead and run with what information they've got, and it may not have all the blanks filled in that need to be filled in, so they're getting the whole story on everything. So it's just, I wasn't comfortable doing it, and maybe somebody else would do it and not think twice about it. That's just how I've always handled things on boards.
Well, it looks
I don't know
like
what you guys want to do.
kind of in a stalemate, and maybe it's something we just want to table for now and address it at an appropriate time later.
Sounds good to me.
Okay, well, I don't know why we're going to table it because I'm just asking the question. What are we going to do when something comes up? It's pretty straightforward. If somebody wants to do it, that's
Such
fine.
as, give me, for instance, something other than this situation, which was.
I don't know what it might be. I've been on different boards and lots of different things have came up that are board related. If she decides that something comes to her that's more appropriate from a response from the board, then she's going to have to initiate some kind of action to have you respond, or like I said, then you've got to designate somebody if you're not available or it's not something you want to speak to. It might be something that Dr. Menegatti is more knowledgeable about because of his background and his areas of expertise, that he could convey the message more effectively. But I just want to know what our plan is. Are we going to send out emails? Are we going to make phone calls? You know, how do we go about, you know, you implementing some kind of action if it's not something you want to speak to specifically about, saying, hey, I would appreciate it if you could talk to so-and-so from this media outlet and answer their questions or whatever. I mean, because you can say as much or as little as you want. And the thing about it is we need to be in a position where we can give them some type of response. I think no response is not proper, but at the same time, like I said again, I didn't feel it was my place to comment on it.
Well, they had all the information, they have the recording, so it wasn't.
I understand that, but I'm just saying they,
Brandy is good about calling me about any and everything. So if she gets something that she feels is a board, that it needs to be done through the board, then she can contact me.
okay, I'm fine with that. It's just simple as that, yeah. Because you have the ability to get a hold of her pretty quickly.
Oh, yeah.
Okay,
And I mean, just obviously to be clear, I don't think this is in question. We can handle pretty much anything. This would just, that particular situation, I wasn't even contacted before the two of you were. And, you know, obviously I was really careful about how I answered anything to do with that even after the original media was done. But I do, you know, try to make sure we have our media controlled in the building so that only people who are familiar with situations are answering questions. So that we don't cause any confusion. So I guess my recommendation in this situation is, if it is ever directed to someone on the board to speak on behalf of the board, it's just that if you have questions about, is this accurate, is that accurate, you know, that you feel free to get a hold of me and talk to me, because you definitely want to make sure we're all, you know, sending out the correct information.
because you do the same thing to your staff. You don't just let everybody that works in the
No.
building talk to the media. You got certain people that are designated to be the spokesperson for the department. That's, you know,
Right, and
same
it's
thing.
really important, I think, too, you know, any of the presentation of my staff as far as, you know, what they're putting out there as far as professionalism and all of that, accuracy of information, keeping things as, you know, inclusive and appropriate as possible when they are speaking and representing the health department. We all take that really seriously as well.
Okay, thanks for the discussion.
Okay, discussion and action for Board of Health appointments.
So we did talk about this last month. Just as a reminder, we do have 3 that are coming up of terms ending in May. It's Vivian, Dr. Jerger, and Dr. Patterson. I did reach out to the county board chairman, and he did have Jeannie Durham get back with me and just let me know that this isn't until May, and it was only January at the time. So I do want to work ahead on this, though, because especially considering we do need to fill spots with specific positions. For example, if Dr. Patterson decides she does not want to be on, we will need a doctor in that position. She has not let me know yet what she prefers. She did plan to come tonight. She just might be late coming in. And then Dr. Jerger did express that he would like to continue on. And then we do need a dentist, so he fit that position. And then Vivian did express to me that she would like to stay on. So our normal process is that the board has, you know, at some point before, you know, May being the last minute, we try to, again, work ahead, is that the board would vote on, yes, we approve, you know, these appointments, and then I send them to county board chairman, and then he decides if he would like to forward those particular people on to the full county board or make some adjustments. And so that will be up to you all when you want to vote on that, or if you still want to vote on it in that same process. But I just wanted to be talking about this ahead of time, especially because obviously one of the positions is our president, and then the other 2 positions are dentist and doctor, which are required in the act for us to have. So I do think we need to be thinking ahead and keeping county board chairman updated as far as whom does or doesn't want to stay on, because some of the positions can be hard to fill sometimes.
Can we do it right now?
We can, again, I don't know about Dr. Patterson, so
Well,
you
we
could
could
certainly
do
vote,
too.
and then if she says no, then that's fine, if the board wants to do that. Or hopefully by the March meeting, I would hear back if she's interested. But it's up to you as the board what you want.
And we have a nominating committee, so we should let them do their job and work on that, I would think, and bring stuff back to the board. Now, I was thinking of bylaws, is it one medical physician or two? Because I thought it was one. You're saying it's two doctors?
I believe it's 2.
Okay. I don't remember. I was thinking that was
And a
on the
dentist.
website or on the bylaws or something that we're required to have one medical doctor.
It's statutory. If you'll give me a couple moments, I can look it up and
Awesome,
I'll let
Mike.
you know. But
Thank you.
it's not a matter of, it may be in the bylaws, it doesn't matter if it's in the bylaws because it's a matter of statute.
Right.
Statute, well, that's what I was, yeah.
And I have that memorized, but it's been a long couple of years. So, I think
I'm not
it's,
sure about the rules of the bylaws, but historically, they have been 2 positions
Yeah.
on the board.
and then a dentist, and then preferably someone with experience in the mental health field. The other position, and then a county board liaison, and then the other positions can be filled, to the discretion of the county board appointment. And yes, I'm fine with the nominating committee doing that. I've helped take leadership of that in the past, just because a lot of times people have wanted to be reappointed. That doesn't necessarily always happen. But if we do have people that are very active and very interested in staying on, I do make sure that the board knows that, so we can forward that on as appropriate to the county board chairman.
It is 2 doctors, 2 medical doctors.
It is, that's statute.
2 medical doctors, 1
Okay.
dentist.
That's good to know, because for some reason I thought I read something somewhere that it said one medical doctor. So that's good to know.
It also states that whenever possible, and again, these requirements are subject to the asterisk of when it's possible, when you have doctors willing to serve. Sometimes you have a situation where you don't have doctors willing to serve, and that presents its own problems. But it also says whenever possible, at least 1 member shall have expertise or experience in the field of mental health. So.
Well, that's important, because if you're looking for a person to serve on a board, and if it's a lay person versus a doctor's gonna be a much larger challenge to find, for sure. So that's important to know that, because that could take some time.
I've been the mental health person over the years because of my role in Heritage.
And for what it's worth, I shouldn't have said expert, it says experience, but yeah.
So, get your question, your answer for.
What was that? You asked the question. I don't know.
Oh, I think you asked, can we vote on it now?
Yeah.
Is that what you asked?
I mean, 2 of them, we could knock them out.
Yeah.
I would counsel against that. You do have bylaws which dictate that a nominating committee process be followed. I believe that you're within your discretion to waive those requirements, but generally it's not a good idea to do that unless an emergency requires it.
You can't really vote on it anyway, because you have to give this to the, we have to make recommendations, give to the chairman ultimately. However that turns out, then after that, we vote on who we're gonna put in those positions, if I understand it.
It has actually worked the opposite way historically. Ultimately, yes, it is up to the county board chairman to appoint, and then the full county board has to approve. But historically, our board has voted on appointments, and then those are forwarded on. It doesn't necessarily mean much, and you can correct me if I'm wrong, but it doesn't necessarily mean much, because you all could vote on 3 people and very passionately want those people, and they basically could be thrown out the window by the county board chairman. So it's more of just like, you all are on the same page of saying like, yes, this is who we'd like to forward on as a recommendation to the county board chairman, but that doesn't mean that's who's gonna actually be presented to the county board.
That's a correct statement. The statute has absolutely no provision in it for the Board of Health to have any say in who gets appointed to the Board of Health. I think historically it's been done that way because the Board of Health is in a unique position to kind of recruit members that fit the expertise required by statute and look for people who would, I guess, fit the needs of the Board of Health and make those recommendations to a county board chairman who may or may not have that level of expertise. But the statute gives the county board chairman the exclusive authority to pick who his appointees or her appointees would be. And of course, it gives the county board the ability to approve or reject those nominees, but no one but the chair can make the appointment.
So in this, your notes here, Brandy, it says, discuss approve appointments for the county chairman. And then it says submits the county board chairman and Jeannie Durham. Who's that?
Board secretary.
Oh,
Send
okay.
everything, yeah.
Well, it didn't give her a title, and I'm just like, I didn't know she's an HR person or
No,
what her position is.
yeah, she, pretty much anything that I send on to him, I also
Okay.
send on to her.
Gotcha.
She does some of the communication back.
Just to
Okay.
clarify that, because
Good question.
like, who's that person?
So we're ready to move on? Okay, discussion and action regarding flex time policy.
Okay, this is another one I was asked to put on the agenda. Mark, I know you and then had asked me to put on, some other board members had some questions just about how that policy works. I did send all of the information out in January, all of the policies and everything for you to look at. So any questions that anybody has, I can certainly answer those now, if you have any, after seeing everything. I did try to make some points in the email that I think were maybe not clear in the meeting where we first talked about it, about how flex time works. So you do have those, and I don't want to just repeat everything, but if you want me to go over those, I'm more than happy to do that. I just think there was a little confusion, and I was trying to clarify it as much as possible, as quickly as possible in January before our meetings and everything.
Any other questions?
Well, to better, learn how this has worked and everything else, Brandy had been kind enough to send a lot of material to me to read through and everything. But I think moving forward, we need better clarification about how this flex time has been appropriated in the past and how we're going to do it going forward. So I had a brief discussion with Mike this afternoon, and I'm going to defer to him because I think we need to clarify status of certain employment status of certain levels of staff, and then visit whether or not who's eligible for flex time and who's not going forward, and make any changes or modifications that the board might deem necessary that are appropriate for those that should be eligible for that. So if Mike wanted to speak to that, I'll let him.
And just briefly, what Mark indicated earlier during our conversation. Here we go. All this talking I've been doing and no one's been hearing it. My apologies. That is very much a part of the course. But what Mark and I were discussing earlier, and Mark had concerns with respect to the modifications to the flex time policy that were implemented, I want to say 2020, if I'm getting my timing right. And obviously those modifications were meant as a reaction to the need to have a staff performing additional work during COVID. And not only that, but the fact that because of staff shortages and the need to work throughout the accumulation of flex time was becoming such that people weren't being able to realistically take it without harming the mission ultimately of the department. You couldn't have people taking the time off that they were accruing. And so the board had made modifications to the flex time policy to allow for more generous payout policies instead of the old policy, as I recall, was more you can accrue it with approval, but you have to take the flex time, what a lot of people might refer to as comp time, within a certain time frame, so that it doesn't come out of the treasury, it comes out of your time working. So that was, I believe, the desire of the board at the time was to make an amendment to the flex time policy to account for the need to have staff work more and the need not to have them taking additional time off. Ultimately, it resulted in, I think, everyone in the health department being entitled to take or accrue flex time, and then ultimately being entitled to payment for that flex time. And what Mark had indicated earlier today was his concern is that under the Federal Labor Standards Act that governs overtime payments for employees throughout the United States, you have a distinction between non-exempt and exempt employees. And he was concerned that we have employees who would normally be considered exempt under the FLSA being entitled to take payment under this flex time policy, which, as the flex time policy was amended, that's absolutely allowed. That's currently the policy of the board, and there's nothing improper about that. It's maybe not common practice here or elsewhere, but there's nothing improper about the policy. But I believe it was his concern that that was not necessarily the intent of the board at the time that the flex time policy was amended. And so he asked me to look into that. I advised that I would have to have an idea from the board about what changes, if any, they would want to make to the flex time policy as it currently exists going forward, and maybe make it more restrictive as to who among the staff it applies to, whether that would be exempt employees, non-exempt employees, or some other criteria. And honestly, at the end of the day, I don't know what the board would want to see happen there. So I'm happy to look at the flex time policy and assist Brandy and her staff with making any changes to that policy that the board wants to make. But Mark, you correct me if I'm wrong, I think I've expressed your concerns, and maybe not all of them, and maybe not as artfully, but.
Yeah, and I mean, the 2 points that you had brought up that would require your expertise, because we're talking about changing something here that obviously would have to, pass through your hands to make sure we're doing everything properly from a legal standpoint is, number one, who is classified as exempt and non-exempt employees, and number two, a review of the policy in general to see what changes or recommendations could or would be made that would be allowed to be made. So that's kind of the two major questions that I had, because I think this was, put in place probably in a really limited time window. I think the intentions are that this would be a temporary policy, and my concerns based on the amount of money that was spent out the last almost 2 years, it's a pretty substantial amount of money, and I don't believe that's probably what the board intended to do originally, and people taking time off versus getting a cash compensation. I actually have an issue with that, as I brought up 2 meetings ago, because people that are classified in a salary exempt status, they're expected to perform their duties regardless of what the hours may require within realistic expectations. But at the same time, I don't think somebody come in here and work 35 hours a week and then they work an extra 10 hours and they're automatically accumulating time, because that should be part of the scope of the job to start with, and that expectation of potentially having to work extra hours to get the job done is kind of an expectation, at least in the business world, that comes with the territory. So I think it's something we need to review, but we need to find out which people are in which classes, because the non-exempt and hourly employees, they're not even part of the conversation. So you just take them out of the picture as soon as you figure out who that is. And I was under the impression of salaried employees, but after you explain the difference between exempt and non-exempt today, then I think that field is going to be narrowed quite a bit. And then that's what we need to review.
I just need to clarify a couple of things, if I may. Okay, so the first thing is that our flex time policy has been in place for a really long time. There were some edits made in recent past, I can't remember what year it was, but to control the number of hours that someone could accrue on their books, essentially. That number ended up being 35 hours, which is the equivalent of our work week. That was what was in place until, well, let me go back. People were not regularly paid for that. They were expected to use that time. If they started getting close to that 30 hours on the books, they were expected to, through their supervisor, set something up, get that time used within a couple weeks unless there was extenuating circumstances. The only time paid out for flex time was if they left. Once we knew someone was leaving, we would try to get them to use all of that to get it down so there wasn't a payout. Now, if they're a key employee of some kind, they may not be able to use it all before they leave. So there may be a small amount paid out when they leave, if it's on the books. That was the only time before that it was paid out. With that change in policy, it was March of 2020. That policy did not say, now you get paid for all your flex time. That policy said, because of COVID and the staffing and the workload, et cetera, you probably read it because I sent it. It said, now you're allowed to accrue over 35 hours on the books because of the workload, the expectations, the pandemic, et cetera. So it didn't say, like, now you automatically get paid for every hour over 35 that you work. And that's not what we did. It was just the allowance for people to accrue over that 35, knowing they may not be able to take that time very quickly. Fast forward to getting grant funding that we could use to pay employees overtime, or in our case, mostly. We did have some people who were considered non-exempt that would have gotten overtime if they went over their 40 hours actually worked. But anybody else would have gotten flex time. And we ended up getting funding that allowed for that. Tons of health departments have done it and used this funding for it. You've probably seen healthcare organizations across the country have been paying out quite a bit of money to be able to staff their functions during this. And so basically that's what our board approved then. We went through all the steps to have it in our grant contracts to pay staff, because what we were finding at that point in the game, this is like August of 2020, so months later. So people were continuing to work those hours, never knowing they'd get sent for it. But then we were able to secure that grant funding and got all that approved through our board and all the steps through the county board. Then if somebody had an exorbitant amount of flex time that they could not take, that they were able to get that paid down. And so that was not all staff. It was mostly the staff who were the lead responders or the people who took more work on, which primarily have been the exempt employees. The way that our system is lined out is anybody that is level 7 and below is non-exempt, and anybody 8 and above is exempt. So primarily the people who were taking on more duties or working tons of hours, which you probably saw the time records that I sent you, that we had staff in some cases working 100 hours a week, that then they were able to get this time, have it on the books. And then when we secured funding, grant funding, that we were able to pay them for that because they couldn't take days off. They were working, 6 days a week or even 7 in some cases. And so that was a way for us to get that time and get that financial liability off the books, pay it down out of grant funding, rather than waiting until the pandemic's over and say, oh, you still can't get all your time taken, we're just gonna, pay it for you out of the health fund or whatever. So that was not an automatic, we're paying everybody for their flex time. Anybody that could take their time was required or encouraged or supported to take their time. But some of us, that was not possible. And it still is incredibly difficult because for the health department, the pandemic is not over. There's still a lot of hours. We still lose people, just like any business that you hear talking about. They can't get staff, they can't get employees. That has been our reality for over 2 years, 2.5 years of covering numerous jobs per person. And so I just want to make that clear. Not everybody's just getting paid out for every penny or every hour or minute that they work. And I'll say this again, I know I put it in my board report. I'm not trying to go on and on about something, but this is a benefit the health department staff have been given at the time that they have signed on to employment. I realize benefits can change, and we do tell staff benefits are subject to change. But our work week is 35-hour work week. I know some of the other county departments are the same. This is the way we've been able to retain staff. This is the way we've been able to recruit staff. We, like any business, are struggling to have enough staff, and I'm telling you, I'm scared every day for who is going to leave next because of everything that we have to carry and everybody having to cover for others who are quitting or leaving or finding better pay somewhere else, because for so many of our positions, someone can go get paid more to work somewhere else. Yeah, they might be in the business world where your expectation is to work a 40-hour work week, not 35, but we are desperate to get people anyway. And if this is taken away, I am very concerned about us losing some really key staff. I don't think that this is abused. Yes, there's been a lot of flex time, not overtime. My staff have not gotten time and a half, unless legally they were a non-exempt person getting time and a half comp time. They've only gotten straight time, and they compare themselves to all these businesses out here, all these, the hospitals, the nursing homes. These people are getting paid time and a half. My staff don't even get that. They've just gotten straight time. So in my opinion, we've got the money, we've got the grant funding, it's all been approved. I understand that, yes, some of them are exempt, and it might seem weird or backwards that they're getting time to work over a 35-hour work week, but I'm telling you, I think that changing that would be detrimental. Some of the people in this building that are in leadership or higher level exempt positions are the ones that work the most and will do everything for you. You can ask them, they'll give you a shirt off their back, they'll work parents in the hospital, kids sick, they don't stop. They're giving you everything that they have. And this is one of the things they are all holding on to so tightly, and I just am very concerned about if you take that. I did say, and I agree, this is a temporary, to accrue over 35 hours right now on your books is a temporary policy. And like I said, that's not always gonna be here. But right now for us, COVID and everything else that we have to do is very, very real, and it's not letting up quite yet. So in my opinion and my recommendation is please allow me to continue with that temporary policy. Not everybody in the building is even getting time over 35 right now. It's just more of your key staff. And that, yes, we stop with the temporary policy when in its appropriate time for workloads. But now is not that time, and to take away flex time from exempt employees in this building, we are gonna have more of an issue than we already have. And that, honestly, that terrifies me. And I'm not just speaking for myself. I know we've talked about it in open, so I'll just talk about it now. Like, administrators historically, including myself, yes, have gotten flex time. Is that what I signed up for my employment agreement? Yes, it is. So I understand why it, might be bothersome to some or think that it's not fair, but that's what we sign up for when we work here and keep dedicating years and years to this place. I'm just really fearful if the board changes that. I would strongly recommend not to, other than taking away the temporary policy when the time is appropriate. Thank you.
Well, I understand what you're saying, Brandy, and I appreciate that, but the problem stems from the fact that we're all out there working a typical 40-hour work week, and you guys are working 35 hours, and then it's like, okay, we worked over 35 hours, so now we're in this cumulative time. The expectation of somebody that's being hired to a specific position, they're getting compensated as part of their salary and their benefit package typically, going into that job with the knowledge that they're going to be required to put in a certain amount of hours to manage or oversee a specific operation or an entire, part of a company or whatever the case may be. That's a conversation you have at the beginning when you say, what's my compensation going to be? What's my benefits going to be? There's never a discussion about this type of thing being done. There could be a performance bonus, that's put into place, or something that's done that, brings more dollars in, or cost savings or whatever. There's a whole lot of different ways where you could look at different things. The problem I've got with this is we're saying we're going to pay you to be a salaried person, but our expectation is you only got to work 35 hours a week. And then over here, I got this person making $12 an hour and saying, well, you only work this many hours a week. That's all you have to work. Beyond that, you get paid overtime. The salary person is getting compensated more money because of the expectation of what they're going to have to do for that job, but also what they bring to the table in terms of knowledge, expertise, training, education, those types of things. That stuff should be discussed up front. I'm not talking about getting rid of this. I'm saying this was done by another board, whole other group of people. We want to enlighten ourselves, educate ourselves about how this policy was created, how it's being done, and look at it and say, does this make sense for us to make changes at this point? And I think we have a fiduciary responsibility to the public. I don't care where the money came from. And that really bothers me, that just because we've got a bunch of grant money, we should just go spend it, and this is what we should spend it on. I would rather you see take some of this grant money and let's spend it on more people for contact tracing, or maybe some of the other things that the grant may allow us. Maybe it's more staff for the environmental to go out and do inspections, or it's equipment or whatever. I don't know parameters. I know certain grants are specific to certain things, but we have the money. We have to spend it. Is not a good reason to justify paying out money. It needs to be reviewed. And I'm not saying that we're going to change it, but I think we need to review it. We need to identify the people that are impacted by this, look at the hours that have been spent, because I think we should be fair. If we look at it and say, you know what, these people are working an average of this many hours a year, and we come back and say they should be given a bonus or increase in pay for compensation as part of the overall package, I'm okay with those conversations. But to have this open-ended situation, like the way I interpret it now, is they're, you know, they take the time. A lot of places have a policy of use it or lose it, whether it's vacation time or whatever. You got till the end of the year to use it, and if you don't, you lose it, and you definitely don't get reimbursed financially for it. So I just think it's something we need to discuss. We need to review it and get, you know, some legal opinion from Mike about what we can and can't do if we decide to make any changes or modifications to this policy. But I think it's a conversation we need to at least start.
There is one other thing I wanted to clarify too, and I don't even know if this is something that's important, but even though our staff they sign on for an annual salary if they're full-time. So let's say, you know, John Doe signs on, he's gonna make, you know, 20,000 per year. If in his first year, he does not have benefit time and has to be off, let's say John Doe's sick, so he's off 2 days of a week. If he has no benefit time, he does not get paid his full salary that week here. He gets paid for the hours that he's worked. If he doesn't have benefit time, he has no pay.
Do you have a salary person there making 20 grand a year?
Yes, we do.
That doesn't even make sense.
How does that not make sense?
Why wouldn't they be hourly?
I guess
I
I
don't
understand your
know.
question.
We're
What I'm
talking
saying
about
is
a
they
whole
don't just get a
different
flat
subject now.
fee amount of money, whether they're here or not. I know that came up before that, you know, if somebody needs to go to their appointment or whatever, they just get to go. Like, we clock in here, I mean, we've talked about that. We have a time clock. We clock in and out. Those reports have been sent to you. Everyone is accountable no matter what level they are for every minute of their time. And so, I mean, if you want to change that whole structure, that's a totally different, you know, conversation, obviously. But I do just want to be clear that people, it's minute for minute. If you aren't here and you don't have benefit time, you don't get paid for that. If you're not here and you have benefit time, you have to put benefit time in. You have to make your day whole for every 7 hours. So I don't know if that, you know, helps with the understanding of it. This is not just like a flat salary. You get what you get no matter how many hours you work. You're accountable for every minute here, whether it's taking or giving. And, you know, we have that time clock that tracks all of that. So it's not just like a willy-nilly, you make $60,000 a year, you work, you do what you do, you have to get your job done. Like, no, it's minute for minute accountability, time clock, reporting, all of that. So if all of that has to be changed, that's obviously a totally different story. But yeah, if we have staff, I mean, we've signed on tons of staff and told them flex time is part of the package. One of the benefits is in your first year, if you don't have benefit time and you need to be off sick, or, you know, if you work over, if you're at a board meeting, you know, till 10 o'clock at night, you're gonna get that 4.5 hours back that you can, the next day, come in late, you know, get some rest, get some extra sleep, be with your family, you know, whatever it is. So it's literally minute for minute exchange. They're not just getting extra time on top of not necessarily working all their time. It's every minute account. It's like a 20 or 15 minute, quarter hour increment the way that it's done. But our time clocks for almost everyone in the building, minute for minute. Even our staff that don't actually do the time clock online are inputting their time minute for every day that they work.
So the people that punch the time clock are level 7 and below?
Everybody uses the time clock, everyone. So we have.
The exempt people
Yes.
fill out, you use a time clock?
I do.
Oh.
And part of the reason, we just got that new time clock, it was, I can't remember,
March
21
March 20,
or 2020?
2020, I think.
Okay, so we just got this new time clock, and the reason we got the new time clock, it's part of the accounting system that the county got, and we needed a new time clock. We had one already, a pretty legitimate one that tracked everything, that everybody was clocking in and out, including the administrator, and we got something even more detailed and more complex. One of the audits that we had recommended that we get something that you could clock in and out of the job code that you're working. And this is part of our world that is different than maybe other businesses. Our grants want to know like exactly how many hours or minutes per day are our staff working on the team prep grant versus the tobacco grant. Because then when Sheree does all of her billing, they get exact numbers when we do reimbursement certifications of how many hours people worked on each grant. And then that's how we get paid. And then when we get audited, we literally are able to show, yes, we're billing or we're requesting funding for this amount of hours per person. And this is exactly what it was. It did or didn't match up. So then we edit the budget or do budget adjustments or whatever that might be. But that is something that was recommended in an audit. So we got an even more stringent time clock that we're using now.
And time clock doesn't necessarily mean a physical time clock. You actually sign on to it. The people that are working from home sign on to the time clock app and log in and log out.
Yep, they can do it on the computer. You can access it on your phone. Yes. So then anyone can do it. And when we have staff that are like out in the field, they're able to still do it.
So Mike, this is basically time recording. It still is not the classification of exempt versus non-exempt.
Right, I mean, an exempt employee isn't typically or always required to record their time. But as a general rule of thumb, an employer is always well advised to have a good record of an employee's time, whether they're exempt or not exempt. An employer is absolutely required to have records of non-exempt employees' time because in the absence of those records, all inferences will be drawn against the employer and in favor of the employee. So that's just a situation you have to deal with. But it's a good practice that the health department's engaged in terms of tracking every employee's time. And obviously, even with exempt employees reporting their time, that may not be absolutely required, but in a grant situation where you're having to justify to a grant monitor at the end of the grant or periodically during the grant, who's performing the duties that they are obligated to do by the grant contract, this is your backup. This is how you defend your grant renewal or ultimately the expenditure of grant funds. So, I mean, this is, I think, a critical process the health department engages in. Are they required to do it for exempt staff? Not necessarily under most circumstances, but it's a good practice.
Any other discussion on this?
So we're gonna provide the information for Mike to review then or not?
We're gonna provide the policy for him to review? What are you wanting him to review?
He's wanting to figure out who's exempt staff and who's not, and then also review the policies that currently is written.
Can I ask a question?
So why, go ahead.
Did you already do that though when the finance committee was questioning the policies? Can you
Yeah.
speak to that? Like, can you
I mean,
already answer that?
When I was asked by the county board finance committee, was it last year? It seems like it was like summer of last year.
Yes, I think so, May and June.
That basically they wanted it reviewed to determine whether or not the policy was in contravention of any laws. And I reviewed it then. I didn't recall until Brandy spoke a few moments ago, the health department has a more structured employee classification system than I think most departments in the county use. And so you can tell at a glance who is considered exempt and versus non-exempt. I believe that is in accordance with the FLSA in terms of the criteria that the FLSA uses to classify someone as exempt versus non-exempt. So again, I would have to look at it on a case-by-case basis to know with more certainty whether each individual who's classified as exempt under the health department's classification matches what the federal government considers to be exempt, and the same for non-exempt employees. But for purposes of this conversation, we'll assume that the health department is appropriately classifying employees as exempt or non-exempt. At a glance, you can tell who it applies to. I think the ultimate question that you were discussing earlier, Mark, is whether or not the flex time policy should be amended to make exempt employees just that, exempt. They would not be able to accrue flex time or be entitled to payouts of accrued flex time, because the purpose of having an exempt employee under the Federal Labor Standards Act is to have an employee who does not accrue any type of additional compensation or any type of additional benefit for work beyond a 40-hour work week.
Well,
That's the definition of exempt.
looking at that, but also looking at whether or not it's appropriate to be paying any compensation out at all, and making it to where the person has to take the flex time and use it in some manner, and whether or not it's extended past the calendar year and carried over. I don't know, because I didn't write the policy. I wasn't here when it was done. And the majority of this board is new enough that I don't think they fully understand this flex time policy, the way it's structured right now, and I think it warrants being reviewed to make recommendations whether or not anything should be changed on it or should be left as it is.
Well, and what we had discussed earlier in terms, you used the word appropriate, and I want to be clear on something. When I reviewed this for the County Board Finance Committee last year, at the end of the day, my role isn't to tell you if something is a good idea or a bad idea, it's to tell you whether it's legal or not legal.
Well, that's what I'm asking. Yeah.
And then I can tell you now, it's what's currently in place is within the powers of the Board of Health to do. It's legal. Whether it's appropriate, and that might be a different question, whether it's a good idea, again, that's a policy decision that is the board's decision to make. It's not something that I can opine on or advise on, whether something is appropriate in the context of being a good or a bad idea. I can tell you it is legal.
Right, and that's why I was asking, if we made some changes or modifications, you would give us a legal opinion that
Yes,
what we're
if you have,
considering
yes,
changing would be, and
absolutely.
again, I'm saying, I'll use the word appropriate, but I mean legal is what
Yes.
I mean to say.
So if you present me with ideas, suggestions, or revisions that you want to pursue or consider, then I can give you an opinion as to whether or not any such revisions would be within the confines of the law.
Not to take too much more of the board's time on this, would it be appropriate or legal for us to look at this specifically, since this relates to employment-related activities? Is this something that maybe the personnel committee should review and research and come back to the board and present some findings or recommendations? I'm looking for some guidance how best proceed so we don't spend 2 hours in a board meeting trying to go through this. I mean, it's no different than the finance committee, going through the budget or anything else. I think this is maybe something where it's a maybe committee level thing to maybe go through the process of looking at everything and bringing some information back to the board maybe in the next month or two.
In terms of how it's provided to me, that's the board's call to make if it wants to be done through committee. Frankly, if individual board members want to bring me requests or ideas, suggestions, I'm happy to review those and provide my opinion on those. It doesn't have to necessarily come from the board. If the board member wants my opinion and then wants to present whatever the board member wants to present to the rest of the board for action, I'm fine with that. It's just not my role to draft the policy without specific direction from the board. So I'm happy to review policies that you draft and ask me to give my opinion on. But if you want me to draft something or come up with, ideas, I have to have direction from the board as a whole as to what your desire is, what you want to see.
Let me take a stab at maybe simplifying this a little bit. And correct me if I'm wrong, but with the current policies, the current flex time policy, we as an organization are obligated to pay for the overtime flex time that's accrued, as we have done. If we reverted back to the policy that was March of 2020 prior, if we revert back to that policy, we are not obligated to pay flex time. Is that
Well,
fair?
I'm not sure. So this may not be exactly the question you were meaning to ask, and I just may be misinterpreting it, Mr. Etler, but in terms of what obligation the board has in light of its current policy, you certainly have an obligation to certain staff members, particularly non-exempt staff members. I think it's a closer question whether you have an obligation as to exempt staff members to honor the policy. I think there's exposure to potential liability if the board were to decide not to pay the benefits that may have been accrued up to this point based on the policy that's currently been adopted by the board and which is enforced. Certainly there's exposure with respect to non-exempt employees. I think it's a closer question. Now, I'm not necessarily prepared to answer with any type of confidence what obligation, if any, the board has to exempt employees based on current policy, since that is not in line with the law.
You're talking about going forward after a certain date, aren't you, Jeff? You're not talking about anything that's existing right now.
I'm
We
talking
couldn't
about
do that.
what I think I heard Brandy say, that at a certain point, we're gonna go back to the old policy where people got 30 hours, and once their supervisor saw that they had 30 hours of flex time, they got no more flex time until they came up with a plan to exhaust down some of that time.
Yes, they always had to keep their accrual bank under 35, but we didn't let it get to 35 before we said, make a plan, get it used.
It was a well-managed.
Absolutely, and the way that policy reads, the policy the temporary policy is routinely, employees will not receive pay for accumulated flex time accrued during their employment. However, if extenuating circumstances arise, the administrator may approve payment for any time worked over the normal work week. So our practice before was that people never got paid for flex time unless they left and happened to have some number under that 35 hours in their bank. They never were paid for it. Even with the temporary change didn't say, now y'all get paid for it. It said, now you can approve over 35 if there's a need. The payment didn't come in for months later because people couldn't take any time off and that time was accruing. And yes, it would have been great to just hire people, but we couldn't even hire people yet. And then it takes a significant amount of time to hire people. So you've still got those same core people in our building that were performing all of those functions that whole time, who then, yes, were accruing over the 35 as the temporary policy allowed, but then couldn't take it. So then when we did have funds that we were able to actually not even reward, but compensate people for everything that they had put in to that point, then yes, that was what the board, and I fully support that. I mean, there are plenty of, like I said, organizations paying time and a half to people, paying $600 an hour to people just to get them to work during this pandemic. I mean, this is nothing compared to that. I realize it adds up, but we also are an organization of well over 100 people, you know, and so the payment is not, it isn't even referred to as like a guarantee in that temporary policy. That temporary policy only allowed the additional accrual. The payment out while still employed was a temporary way to reduce the financial liability for the health department and get that time off the books for people that were doing the jobs. And yes, we could hire more people. We did hire more people, but still then people leave. And then there's people, the core people, again, that have to cover those things. Those people have to be trained. People have retired. And so not everybody, I sent you a list of who actually has flex time on the books right now. It's not even the same number of people that we had before, because now it's a smaller group of people that even have to go over that accrual of 35. There are people who can take their time that aren't having to accrue over 35. So that number is going to keep, going down. It's just a transition as we work through this pandemic and hopefully get out on the other side of this. But yes, it's been very controlled over time. It's been kept under that 35. Our supervisors have been incredibly responsible, and staff know, because yeah, it's a benefit. You want to take advantage of it. So they know you have to make a plan, you have to use it. So you don't get to that 35 or go over, or you're not allowed to accrue over with the regular policy.
And Brandy, and this is just for exempt employees. The non-exempt pay time and a half.
After 40 actual hours worked. So non-exempt employees, they, also have that 35-hour work week. So between hours 35 to 40, they would get flex time if they went over. But then once they got to that 40 actual hours worked over that, they would get paid the time and a half. And yes, we would always pay that out, not just during COVID, because that's the law that we have to do that.
Pay, they don't accumulate the hours, you can just go ahead and pay it.
Yes, the comp time, yes, the overtime, yeah.
Overtime. It's
So that-
overtime, they don't do comp time, it's overtime for them.
Correct, yeah, they get the overtime time and a half, and that's always because that's the law. I will say,
I hate to interrupt you, Brandy, I apologize, but just to be clear, flex time policy, it is permissible to have someone accrue comp time or flex time at time and a half in lieu of payment. You can have a policy to that effect. So it's common practice for anyone who accrues more than 40 hours to simply be paid out the overtime. But just to correct what you're saying, you can legally have a flex time policy which allows for the accrual of time and a half where you don't have to pay it out
right,
in cash.
I'm aware.
Okay.
I was speaking to what we have done. We don't leave that on the books. We have historically paid that out.
I think that was a change.
You're not talking working over 40 hours a week, you're talking about 40 hours of accumulated time over a period of time.
You're talking about for non-exempt and
Yeah.
the overtime. That's, so in a week, as you know, if non-exempt work over 40 hours actual work, then they get that time and a half. We pay it out.
But Mike's saying
But the flex time,
we could give
We
them
could just
flex
put time on the books. These people on this list, though, that we've given you, most of those people are not of non-exempt level. Most of the people that we have paid out for doing the extra work or taking on the greater load have not been, they have been that exempt level or higher in our organization just because of the expectations and the people who have taken those on.
It's all exempt.
I'm talking flex time accrual bank. Accrual bank is not just for 1 week. That's like your overall accrual bank.
Right.
So when I say people historically could only get 35 hours in your accrual bank, it's like your vacation time. Okay, you got a week of vacation for the whole year. This is like you can get up to 35 hours on your books at a time. And it rolls. It's not like a calendar year, anniversary year. It rolls. But we've always kept that under before COVID. And it was very controlled. And that's the way that we handled that.
Okay, so that being said, and this might address part of the concerns or whatever. If you can look between now and the end of the year, do you see any clarity that we could go back to the policy before the temporary policy was put in place? Are you seeing a decrease in activities? In the last 90 days, 6 months, are you seeing a decrease where you feel like in another 3 months, for example, this will be back to almost what we would call normal levels of activity? If things continue on, as far as COVID goes, if things continue on the trend downhill, or that stuff starts to subside, at some point you could come back and say, we don't need to have this temporary modification put in place. Because I don't want to spend a bunch of time on this, and you come back 2 months from now and say, you know what? Our numbers are like 5 people a day, 10 people a day. This thing is pretty much on its way out the door. We're not having to have people work a bunch of extra stuff. We're gonna make a recommendation to the board that we go back to our old policy. I guess, is that something you feel comfortable even thinking about at this point yet, or?
Yes, and that was my recommendation in my packet. We've already seen a decrease in how many employees have had to go above and beyond to this exorbitant amount of hours. Obviously, we've done everything in our power to hire staff, replace retirees and all of that. But like anywhere else, we're having short staffing, or you wouldn't even see as many people right now with extra hours, but they're having to cover things. But yeah, as far as COVID goes, I hope we don't have another surge. I hope so badly. But if it keeps going in the trajectory that it is, I do think that I can bring a recommendation to you. I mean, we're updating about COVID every single month and where we're going and where's the funding and how many people do we need out of this contact tracing grant. I definitely think if you could give me the ability to come back to you and say, every month, here's where we are, and then say, I think it's time that we can take this away. And then if we do have a situation where someone's having to cover an extra amount of hours because somebody's on leave or because they, are sick or something like that and we can't hire, that's going to be something that could be considered an extenuating circumstance, just like in the past, which is extremely rare. But this is, for people to have these hours on the books or get paid out, that's not regular operations. That's pandemic operations. So yes, if you would give me the ability to just keep it the way that it is as of right now and keep doing everything that we can to update you and then let you know, I think that we're ready to do away with this temporary policy. That is what I would prefer and appreciate, because we're not out of it yet. We wish we were, trust me. Everyone on my team, people tell me like, they just want time. They just want to be able to take their days off. They just want to be able to go home and not have to work all evening long or all weekend or every holiday. They desperately want that. So trust me, none of us are like hungry to keep getting flex time.
Okay, I appreciate that. So here's what I'm gonna offer, propose, give you, however you want to take it. I would like for, as part of your monthly report on the COVID stuff, if you could provide us somehow in the packet or communicate it through, email to us or whatever your preference would be. If you could give us and we'll just, because obviously you've already covered the status with non-exempt employees about compensation. Give us like a monthly report of where exempt staff is at exempt, for example, on their hours, and maybe go back the last 90 days, and then we'll look at 90 days going forward and see if the trend of hours changes with the level of activity to where we start to see this going the direction that you feel it may go. That would make me feel better about whether or not we pursue discussions about trying to make changes or modify this policy prematurely as it currently exists. Because I don't want to burn a bunch of time working on this when you come back 2 or 3 months from now and say, you know what, we're almost down to normal levels again. Then we've wasted a lot of time.
So I guess are you asking for like time clock reports of number of hours?
No, I don't want you getting specifics.
Time.
Just give me hours of flex time accumulated, that matches up every month with the rest of your reporting, saying this is where we're at for the last month. This is how many hours we accumulated flex time. So I could see a downward or upward change on a monthly basis, that flex time's going up or it's going down, because then we can have that conversation with you. We can have a real brief conversation. Why is this going up? Are we getting down to a level where you think we could suspend the temporary flex time policy? Give us a little bit of information every month, just as kind of as a guide,
Okay.
if you will, so we can better understand where you guys are at with this, because I don't really want to get into this. I prefer to do something that's real simple, and I think that's something that's easy to digest and easy to understand. Otherwise, I think we need to have a conversation about making some modifications or changing policies that exist.
Okay.
But I'm fine with waiting, but I'd appreciate having that information so we can keep making informed decisions about the direction we're going with the money we're spending. And I would really appreciate, obviously, as things turn the corner maybe on this, that we really emphasize to the staff, obviously, the preference for them to take the time as much as possible, as much as they can. Because the downtime, I think in most cases, is more valuable than getting the money, because you're still working.
And
I talk to nurses at the hospital. I know Dr. McGotty's in there every day. I talk to these nurses, they're working 6 days a week, 12 hours a day. And it's like, you're gonna get burned out after a while. You gotta have some downtime somehow.
And I agree with you. And I do say that all the time. But I do want to make sure the board understands, and I've tried to communicate this a lot. Our staff have been working those hours too. And that's not to discount what nurses, doctors, anybody else has done. We all have been in this nightmare together. But just so you all know, like, that's what my team has done. And that's why when I come at you so passionately about protecting them and appreciating them and letting them get their time, that is why, because they have work, and I don't want them to burn out. I don't want to lose them. I don't want their health to go down. We've already seen detrimental impacts, you know, so yes, I want them to take their time. But for most of this pandemic, it was nearly impossible for several of us to take any time off. And that's not being dramatic. When the need is there and lives are on the line, you have to do what you have to do, and that's what our team did. So I appreciate it. I could definitely bring like an accrual of how many flex hours are accumulated per month. I think that I'll probably bring a similar report to what I sent you in January, but when I get that out, if there are tweaks that you request or anything, I can certainly revisit with Sheree and get something else to you.
Jeff, does that kind of answer your concerns? Does that work for you?
I think so. I think I understand everything that's going on, and I look forward to
I appreciate the explanations tonight from Brandy and Mike both, because it's enlightened me a lot more, it really has.
But I look forward to a speedy reversion back to the old policy. This is a point.
And I will.
And we'll look forward to you bringing that to us.
And we're all here looking forward to that too. Like I said, my staff are not hungry for flex time, they're hungry for work-life balance at this time. And then I will also say, just so you all know, historically, health departments are underfunded and understaffed pretty generally across the state. So we have made moves before COVID even hit to try to do some restructuring and to do some different delegation in the building so that this isn't a problem that just continues on. And so we don't have people burning out. We don't have people with such a huge workload that it's impossible to complete without working 6 or 7 days a week or whatever it is. So we also have made changes proactively before we ever entered into this COVID world to try to not lighten the load to where our staff have easy jobs, but to where their job is actually realistic to do in 50 hours a week rather than, more than that every single week. Because I do think it's important that our staff have work-life balance and downtime. I absolutely believe in that. And we'll keep doing that and looking at things.
I have one more question for you before we go into closed session. In your notes on activities you had here, am I to understand that you were able to complete getting keyless entry done for the building? Because you got something here about training and stuff.
Yes, so where we are at now on it, the building commission did get it installed, or the company, on certain doors in the building. They're starting with a small number, and then hopefully we'll branch that out as we go. And the next step that we have to take is basically getting everyone in the system and everyone else trained. Our core group got trained. We are very short-staffed in administration, and we're the ones that are going to be training everyone. So right now, that's the point that we're at. We got our training with the company, and now we just need to move to a lot of data entry, which we don't have someone to do right now. We're trying to get someone on board that can do that, and then getting everything building. So that has moved, and yeah.
What's your issue with the data entry stuff?
We just have to enter, so they have a program, and we have to enter all of our employees into it in order to then grant them access for which doors they're going to be allowed into and everything. And we did get a system that we could use for right now that would work with our regular badges. So equipment-wise, there's not going to be an additional cost with that or anything for us. It literally just goes on the back of your ID badge where you can scan and get through the door. So.
But the in-house IT staff is doing that work, right?
Which part?
The data entry stuff then?
It's going to be, IT is part of administration. So yes, between us, we'll be getting the data entry of all the staff and their information and then their accessibility.
So you think in the next 30 days or so, you'll have that completed?
I don't know about 30 days. We've lost in the last 2 months an IT person and an administrative specialist. So we're again covering more things. So I can't guarantee 30 days, but I will. But that is definitely something we're trying to move on. Really excited that it's here.
Okay, thank you. We have a motion to move into closed session.
So moved.
Thank you. Roll call vote, please.
Vivian Goodman,
Yes.
Mark Scranton.
Yes.
Jan Hack.
Yeah.
Candy Carpenter.
Yes.
Jeff Inman.
Yes.
Debbie Hill.
Yes.
Dr. Van Campen Bonte.
Yeah.
Cody Parks.
Yes.
Okay, motion carried. We can move into closed session.
All right, I'm going to stop the recording. Evan, please confirm with me when you have stopped the live stream.
Thank you, staff, for joining.
we have a roll call, Vicky.
Vivian Goodman,
Here.
Mark Sturgeon,
Here,
Jan Hack,
Here.
Kenny Clevenger, Jeff Edwards,
Here.
Debbie Hill, Dr. Benjamin Bonte,
Yes.
Cody Parks.
Okay, so the business at hand is to approve Brandy's, payout of Brandy's split time that was presented to us at, I don't remember which, just in November, December? Okay. Me. Okay, Debbie, thank you, and a second.
Second.
And, okay, thank you. And a roll call vote?
Vivian Goodman,
Yes.
Mark Sturgeon,
yeah,
Jan,
Yes.
Kenny Clevenger, Jeff Edwards,
Yes.
Debbie Hill,
Yes.
Dr. Benjamin Bonte,
Yes.
Cody Parks.
Yes.
Okay, thank you, motion carries. Is there anything else that you, okay, okay, all right, we'll entertain a motion to adjourn.
make a motion.
I second.
Thank you, and a roll call.
Vivian Goodman,
Yes.
Mark Sturgeon,
Yes.
Jan Hack, Kenny Clevenger, Jeff Edwards,
Yes.
Debbie Hill,
Yes.
Dr. Benjamin Bonte,
Yes.
Cody Parks.
Yes.
Thank you, motion carries.
Okay.
Thank you, everyone.
Thank you, everybody. Have a good night.